Hi, my name is Leah Beasley, and this is my presentation on the professional practice model of VCU Medical Center. VCU Medical Center is a very big health system. They have numerous facilities and location. Mainly is the VCU Medical Center downtown Richmond. They also have a Children's Hospital of Richmond at VCU. They have satellite locations for the Community Memorial Hospital, Tappahannock Hospital, and the Massey Cancer Center. They also have over 70 outpatient clinics in Virginia. For this presentation, I will mainly focus on the downtown campus. So here are some numbers to give you an idea of how big the health system is. Just for the downtown location, they estimate around 36,000 inpatient discharges in a time frame of 1 year, over 78,000 emergency visits, and over 930,000 outpatient clinic visits, and a total surgeries of over 26,000. Patient beds, they have a total licensed bed of 815 beds, and they additionally have 65 staffed NICU bassinets available. Being such a large health system, they also have a few specialties that they are well known for. So they are made up of one college and 4 health sciences schools. They are an academic medical center, a teaching hospital. They are a level 1 trauma center, and they are one of only 2 NCI designated cancer centers in the whole of Virginia. They have the region's only full service children's hospital, and they have more than 800 physicians in 200 specialties. They have dedicated research teams, facilities, and valued partners in every field as well. VCU has been recognized nationally for the type of hospital that it is and the specialties that they are excelling in. It has been rated number 1 hospital in the Virginia metro area for the 8th consecutive year, and number 2 hospital in Virginia for the years of 2018 and 2019. They also ranks among the top 15 in the country for urology, nephrology, orthopedics, diabetes, and endocrinology. They are high performing, which means that they are close to ranking 50 in the country for cardiology and heart surgery, geriatrics, neurology and neurosurgery, and pulmonology. Given all those great ratings, VCU is definitely a quality health system, and I think it is important to look at their professional practice model to understand what made them so successful. One of the main things that they utilize, especially for nursing, is the STAR service. This is an original professional practice model, so they came up with that model on their own and put it together and used it throughout the years. So the STAR service, each letter stands for a goal or priority that they're asking every team member to focus on. The S is for safety first. VCU's vision is to be America's safest health system, and safety is the number 1 priority for patients and for the staff. T is for teamwork. They encourage working together to improve patient outcome and team satisfaction. A is for accountability, taking responsibility for my own actions and also holding others responsible for theirs in a respectful manner. It's also used to be able to improve patient outcomes without having negative consequences. And letter R is for relationships. They're a very relational-oriented hospital. They encourage relationships between patients, but also the nursing staff and the interdisciplinary team. Being a teaching hospital, we see that a lot with encouraging everybody to fully take their place to be part of that team to benefit the patient. So looking more into details about the components of that STAR service, the professional values that they encourage is making everything about safety to make that sure that it is a priority. Service by putting patients' needs first. They encourage trust through commitment to privacy and accountability. They want to see a positive attitude, showing compassion and kindness to our patient population. And also respect is another professional value. Respect of every individual's dignity and celebrate diversity within the people that we are fortunate to serve. The leadership and governance structures are also very distinct. Their services are governed by two separate boards to make sure that it is fair. They also hold the daily safety huddles with the command center to look at day-to-day management of the health system. Professional relationships are also highly viewed at VCU. They value the interdisciplinary team, and each member has an important role to play. They really encourage everybody to fully take on their role to improve patient outcomes. They use teamwork and accountability to achieve that goal the best way possible. For the development of nurses, they encourage every nurse to practice in their full scope. They have opportunities for advancement of the practice through training and challenging the clinical ladder, which we are about to take a look now. VCU wants to recognize nurses who have the highest standards of professionalism and excellence, and they do so through their clinical ladder advancement program. This program has 5 levels. To go from one level to another, you have to create either a portfolio or a presentation project, and you go in front of a board of equally certified and on the same level nurses that you are, and you present how your practice has reached the next level of competency and a new standard of professionalism. It goes from being a novice nurse all the way to being a master nurse. We will now take a look at a critique of the professional practice model of VCU. First of all, we'll look at the framework. The framework actually is very clear. It has clarity and it's simple. They have used acronyms to help nurses to remember what the main goals are, the STAR service with each letter standing for one of the main goals, like we talked about earlier. It is easy to apply and it's displayed through all units throughout the hospital. It is reinforced in annual training, and it's also used as a criteria for annual evaluation for nurses. Each nurse is asked to provide examples of how they have met those standards in their practice. It is basis for holistic care. All aspects of care are being addressed within that model. Patients are encouraged to be treated as individuals, and patients' physical and emotional needs, as well as their safety, dignity, and respect are priorities. All of this achievable by teamwork. Additionally, this model promotes decision for all people involved in the healthcare system. It involves patient, family, and the interdisciplinary team. It is a foundation of being a teaching hospital, empowering people to really take their place and make a difference where they are. They have encouragement and monthly awards for the STAR service. They have the Spotlight employee that they send on their website and also send via emails to encourage people and give examples of what STAR service looks like. And it is also empowering patients for their care. They have programs such as the Daisy Award nominations for nurses when patients would like to recognize the exceptional care they've received for nurses. And the actual characteristic of the STAR service are displayed on those nomination forms. And they also have patient satisfaction surveys to make sure that the model that is being used is serving our patients for the best. So in conclusion, the professional practice model that VCU uses, in my opinion, is very effective. I've worked for VCU for almost 8 years, 3 years as a care partner and 5 years as a registered nurse. They definitely have helped me engage in my practice and also know what my priorities are, especially regarding safety, accountability, teamwork, and relationships. Thank you so much for taking the time to watch my presentation.